I'm Dr. Steve Hotze, and it is a pleasure to be here. Now, if you're sick and tired of being sick and tired, then what I hope over the next 30 minutes or 40 minutes during our discussion that you will see and have a glimmer of hope on how you can restore your health. Not just restore your health. The reason I want to help you restore your health is so that you can transform your life. You know, you can't have a good life if you don't have good health. It's very difficult. Unhealthy people just don't seem to do as well in life or enjoy life as people that are healthy. Does that make sense? It's just hard to be positive all the time when you don't feel well and you don't have any energy. So the whole goal in my approach to individuals is I just don't want to get them healthy. I want to get them so their health is restored, so they have transforming experiences in their life. Why? So their lives get transformed, so they can improve the world around them, so you can make a difference in life. You got to ask yourself, am I alive or not? If I am alive, am I making a difference in other people's lives? Am I creating value and leaving a stamp of the fact that I was here and I make a difference in people's lives? Well, if you don't feel well, there's no way you can think about anybody but yourself. How can I solve my health problems? Well, I'm here today to give you some encouragement and help cultivate in you hope. And I hope when you walk out, I will have instilled a sense of well-being and maybe even fulfilled some of your unexpressed wishes and needs, just simply by having a discussion with you. Now, how many people in here have or think they have PCOS? Raise your hand for me. Thank you. Okay. I asked in my groups, when we had two little breakout groups, I asked them, okay, how many of you all with PCOS are seeing a physician right now? Raise your hand. Okay, raise your hand high. Let me see. How many of you seeing a doctor? Okay. How many of you have seen a doctor? Raise your hand. Okay. So everybody in here is either currently seeing a doctor or has seen a doctor and given up hope. Let me ask you this. If every one of you has seen a doctor, and any of you been treated? Raise your hand if they've given you treatment. Raise your hand. Okay. Why are you here? Help me understand that. If you've been to see a doctor and been treated, why are you here? Somebody answer that. Why are you here? You should be well. Well, if you're not well, what does that tell you about your treatment? It's not the right treatment if you're not well. I can't understand for the life of me why anybody would keep seeing somebody and being treated the same way over and over and expect to get anything different than the results you already got. That is insanity. That's the definition of insanity, to do the same things over and over again thinking I'm going to get a different result, okay? So I'm here to challenge your thinking. I'm here to get you to say, you know what? Maybe that guy I'm seeing doesn't know what the heck he's talking about or she's talking about. How many of you all, let me just ask you this, by your current physician, how many of you all feel understood? Raise your hand. Some of you feel understood. Not many. How many of you all feel appreciated? How many of you all feel affirmed? Okay. So we have a handful of doctors that are making you ladies at least feel good, right? What about the rest of you? How the doctors make you feel? Has anybody ever had a doctor make you feel like you're a hypochondriac? Raise your hand if that's happened. Hold on more. Made you feel like it's all in your head? How many of you in here have been recommended by a physician that you need to be on an antidepressant? Raise your hand. Okay. Polycystic ovarian syndrome. Is that a diagnosis? How many of you in this audience, of course some of you have already been to my class, my breakout session. How many of you think polycystic ovary disease is a diagnosis? Raise your hand. Okay, a few do. Some of you have been in my class. Well, if it's not a diagnosis, what is it? What is it? Somebody tell me what it is. What? It's a syndrome. What's a syndrome? What's a syndrome? Here you've got polycystic ovarian syndrome, and you don't even know what a syndrome is. A syndrome is just a compilation of symptoms. And when they appear together, they give it a name, and they call it a syndrome. So if you have polycystic ovary disease, either you have fertility problems or menstrual irregularities or you have androgenic, and plus you have some excess androgen in your body, which gives you hirsutism, and you have polycystic ovary disease, and you have these various certain characteristics. They say, these three things come together. It's a syndrome. They work together. But it's not a diagnosis. You've got to ask yourself, what's causing the problem? What causes polycystic ovarian syndrome? Well, let me say this. Where's my book? See this here, right here? Hypothyroidism. 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 I look around this room today, I swear it looks like I'm in a room full of hypothyroid people. Almost every one of you looks classically hypothyroid. I have a book for you that I want you to have complimentary, Hypothyroidism, Health, and Happiness. And it's the most common problem in America today, and it is the most commonly unrecognized, undiagnosed, or misdiagnosed problem in America today because the doctors wouldn't recognize it if it had walked in and slapped them in the face. You ladies have gone to the doctor. How many of you in this room have ever Googled hypothyroidism or looked it up and read anything about hypothyroidism? Raise your hand. Okay. How many of you have gone to a doctor and had a doctor take a thyroid blood test on you? Raise your hand. Okay. How many of you, and when he took the blood test several weeks later, if you ever got in touch with him or the office, finally when you got in touch, after going through, the whole mechanism, what did they tell you? Your blood work is normal. It's normal. So what does that say? Does that mean I don't have any hypothyroidism problems? The blood work's normal, so it couldn't be hypothyroidism, right? If you can believe the blood work, and you can't. You can't believe the blood work. At my center, we have treated over 30,000 people for hypothyroidism with desiccated thyroid. 30,000 people. And we've seen the remarkable work that it does. Now, polycystic ovarian disease, if you have hypothyroidism, guess what happens? Guess what it does? Slows your what? Metabolism. Why? Because thyroid hormones enable your cells to produce and use energy. Thyroid hormones made by the thyroid gland in the neck. It's got to get in every cell of your body. Every cell in your body's got to produce energy. If you don't get enough thyroid in your cells, you run sluggish. You run slow. Guess what happens? You get fatigued. Anybody here have any friends that are fatigued? You have difficulty with weight. Anybody here know anybody that's having difficulty with weight? Cold body temperatures oftentimes. Insomnia, inability to focus. Anybody know anybody that's ever had brain fog? Joint and muscle aches and pains. Poor bowel function. Irritable bowel syndrome. Loss of romantic moods and inclinations. Hair falling out, puffy, pale, recurrent and chronic infections, menstrual irregularities, infertility, miscarriages, brittle fingernails, ridged on your fingernails. These are all classical features of hypothyroidism. And I bet if you went down the checklist, you would check off most of these symptoms. you've got them. Well, when your body runs sluggish, what does that affect? Well, you think that has effect on your ovarian function and your sex hormone function and your adrenal hormone function? Of course it does. People with hypothyroidism have enlarged ovaries. I just read a study done from, it was in the Saudi Arabian Medical Journal from the medical university there on the relationship between hypothyroidism and polycystic ovary disease. And they were treating with synthetic thyroid, and they were getting 50% resolution of the so-called PCOS, just putting them on synthetic thyroid, which we don't use. We use natural thyroid. But long and short, you go to your doctor, and your doctor says your blood tests are normal for thyroid. That doesn't mean that you don't have hypothyroidism, because thyroid hormones don't do anything in the blood. Guess where they work? In the cells. They've got to get into your cells. And there are conditions in your body that will prevent thyroid from being properly assimilated into your cells. One of which is estrogen dominance. You make two primary hormones during your menstrual cycle. Estrogen the first half of the month, progesterone the second half of the month. To make progesterone, guess what you have to do? You have to ovulate. Guess what many women don't do who have PCOS? They don't ovulate. So all they do is make estrogen hormones, which is the proliferative hormone, so they get a bunch of breakthrough bleeding and menstrual irregularities. They're infertile. And guess what? When you make excess estrogen, guess what that does? That causes the liver to make a protein called thyroid-binding globulin. When you don't menstruate regularly and you don't make progesterone, your estrogen dominates your life. Estrogen causes you to do what? Gain weight. Causes you to deposit all your sugar into fat. So you're estrogen dominant. Then it causes the liver to produce high levels of thyroid-binding globulin, which gloms on to thyroid hormones in the blood. So now you've got less thyroid because you've got the situation of estrogen dominance. And you've got all the classical symptoms of low thyroid, but you go to the doctor says it's normal. Well, I'll tell you what. Here's how they determine what normal is. And the doctor doesn't determine the normal. The lab determines the normal. And here's how the lab determines the normal. They take the last 1,000 blood tests, and they take the average on the TSH, thyroid stimulating hormone, and they do plus or minus 2 standard deviations. That's a statistical term. When you do 2 standard deviations from the mean, that's like a bell-shaped curve. Have you heard of a bell-shaped curve? Okay. Everybody falls under the bell-shaped curve. 95% of the people fall under 2 standard deviations. Wherever that is, the lab says, that's normal. Why is that normal? You're going to call it where 95% of the people fall, if they're up here or down here, as long as they're within this very wide range, tall range, like the Empire State Building, as long as they fall in, you're going to call them normal? That's normal? Why is that normal? You've done blood tests, and the doctor says your blood tests are normal. You go, but I'm not. So the blood tests, we can draw your blood. You can draw the blood on anybody. Send it to the most brilliant doctor at some ivory tower medical school who doesn't treat patients, just takes money from the drug companies to teach the students how to use drugs. And you can show him the blood work, just the blood work. He can't tell you if it's a man. He can't tell you if it's a woman. He can't tell you your age, and he can't tell you your symptoms or your signs. You go to the doctor, and you get blood work, and he says your blood work is normal. They end up treating you with drugs. You get on antidepressants, then you get on metformin, you get on spironolactone, or worse yet, they put you on birth control pills to control your periods, right? Because you're not ovulating. Well, now you're having breakthrough bleeding because you have estrogen dominance. Are birth control pills normal? Are they natural hormones? No. They're counterfeit drugs that mimic hormones. And what do they cause? They cause estrogen dominance. They cause you to build up high levels of thyroid-binding globulin. They cause you to gain weight, have headaches. It may control your periods, it may not. But many people just feel terrible, and the situation gets worse, but you got your periods controlled. Why, if a guest or patient comes in with the signs and symptoms of low thyroid, why in the world would you not give them a clinical trial of therapeutic thyroid? How simple is that? If somebody walks in off the desert and they're thirsty, I don't need to do $1,000 worth of blood tests. I say, why don't we just try giving them a glass of water and see if that quenches their thirst? Okay? This is really not complicated. And it really, you know, and I've been on this for years, ever since a friend of mine in 1991, Dr. Richard Mabry said, and all I did was allergy back then, but I saw lots of women coming in, and they had problems, and their problems developed oftentimes after they had their first or second baby, and I bet a lot of you had your problems developed after you had a baby. They developed these problems, and I knew, and they would have problems with allergies and infections that they never had before until they had their baby. So I knew it was related to hormones, but I didn't know what to do about it. So I just go see your OB-GYN. They'd slap them on birth control pills, and they'd get worse. Come back and they felt worse. So finally, Mabry comes up and said, Dr. Mabry says, Steve, you've got a lot of women in your population that have hypothyroidism. You ought to treat them. And I looked for one thing, autoimmune thyroiditis. That's where you make antibodies to your thyroid gland. Has anybody in this room ever had the doctor check you to see if you have antibodies to your thyroid gland? Raise your hand, I'm curious. Now that is a tragedy. That's a tragedy. Because looking at you, I bet 30 to 40% of you have autoimmune thyroiditis. You have antibodies to your thyroid gland. They won't check it because you're on an insurance plan and the insurance company won't reimburse them. It's all about medicine being practiced based upon reimbursement. Autoimmune, that ought to be checked. Guess what? I found out about 30% of all our guests, and we've done it for the last 25 years, have antibodies to their thyroid gland. They're attacking their own thyroid gland. And that causes fibrosis thyroid gland. Either they don't make enough thyroid, it burns out the thyroid over a lifetime, and those thyroid antibodies, those autoimmune antibodies glob onto the thyroid and they affect the receptor, so you can't get enough thyroid into your cells. You can have thyroid in your blood, but if you can't get it into your cells, it doesn't do you any good. It's like having a lovely house, but your key doesn't open the door and you can't get in. Autoimmune thyroiditis. So anyway, I started treating our patient. I said, what should I use? He said, use Armour thyroid, desiccated thyroid. A few of you have been diagnosed with low thyroid and been put on synthetic thyroid, which in our clinical experience, doesn't work. We've seen thousands of people on synthetic thyroid who go, their blood tests are now normalized, and the doctor says, well, can't be thyroid, you got normal blood tests, but I still feel terrible. If you're taking a preparation for thyroid that's supposed to resolve your problems of low thyroid and they don't, then the medicine's not working. I don't care what your blood test says. I don't know why a doctor can't figure this out. You're trying to correct my problem. If it's not working, why would I keep taking it? It must not be working. Oh, we don't know what else to do. You're going to have to learn to live with it. Exercise more, eat less. I'm eating like a pigeon, and I've got no energy to exercise. Okay. I feel like I'm General Patton up here. Y'all don't know. Trying to marshal everybody off to war here. Get yourself. Really, I just wrote this in my second book, Hypothyroidism, Health, and Happiness. I'm on a 30-city tour. I've been to Dallas. I've been to San Antonio. I've been to Minneapolis. I'm going to Washington, D.C. and Baltimore this next week, and then on a tour through Florida and all the way up California, because I'm trying to raise up a standard. My first book was Hormones, Health, and Happiness, which is a good one, too, a great one. We sold and distributed 85,000 of those. My goal is to have 250,000 of these distributed, and I want to give them to you complimentary, okay? Why do I want to do that? Because I want you to be educated and understand what your problem is. So you don't go on like this 5 and 10 years from now, you're coming to these PCOS conferences and you're just getting sicker and sicker. Because I want you to enjoy life, for crying out loud, in a bucket. Why would you want to? Is there? And I say on this book, this is the book your doctor doesn't want you to read. And they know I'm out after them. I'm on the radio if anybody knows, I'm on the radio in Houston, 12 to 1, Monday through Thursday. If I'm not traveling on my book tour, I won't be on it much unless it's a tape. I've been on for 12 years. Either Dr. Sheridan or Dr. Ellsworth will be on. I've been on the radio. I'm on Deborah Duncan twice a month, and I pound on this every time to get the message and trying to give you hope that you can get out of the funk you're in. Because I don't want you to have to show up on Sunday mornings at POS conferences the rest of your life. There are plenty of other people that can show up that we can help. Then we can give you help and get you on a path of health and wellness. Now, let me just, in closing, let me just mention to you again, hypothyroidism is a most common problem that I've seen in America that is most commonly undiagnosed, unrecognized, and misdiagnosed by the profession. And if they stumbled onto it and do diagnose it, they give the wrong treatment. So nobody gets well, and they walk around with hypothyroidism. And that's a real problem. So I want to help each one of you all restore your health so that you can transform your lives and so that you can improve your world and do it naturally. Okay, any questions? Anybody have any questions? Yes, ma'am.
How is it that all of our thyroids are having problems functioning? What's causing that?
Why is it, in other words, why are so many people having hypothyroid problems? Great question. And there's some really good, there's some good responses that you'll find interesting. Let me give you some statistics first. Today in America, 67% of the people are overweight. Half of those, which means 34% of the population are obese. In Italy, in France, and in Europe, you know what the obesity rate is? 8%. We're 4 times as much. Now, guess what we were in 1960? 8% in 1960. So what has happened since 1960? What has happened? Well, there are a couple of things that have happened since 1960. One, I would say, is the advent of birth control pills and the ubiquitous use of birth control pills, which turn off your natural production of hormones, puts you in a state of estrogen dominance, and that leads to buildup of thyroid-binding globulin and ultimately hypothyroidism. And the doctors say your problems can't be related to your birth control pills. I mean, I've had women tell me, and it's not, maybe it's not the birth control pills, it's the counterfeit hormones that go to the change of life. They feel terrible on them. They go, Doc, could these pills be making me feel this way? And they're so incompetent. They go, no, drugs could never make you feel bad like that. Well, why do I feel so bad? Well, it must be in your head. You must need an antidepressant because nothing I give you could make you feel bad. Okay, that's one thing. The other thing is fluoride in the water. Now, this is kind of interesting, and I've heard about that all my life, fluoride in the water. And I remember I'm old enough to know there was a big controversy in the United States about whether or not you should fluoridate the water. Back in the 50s and 60s, and a few of you are not quite my age, but can remember that. But there was a big discussion. Should we let them put some chemical into our water? It's supposed to help with tooth decay, which studies have shown and proven it really doesn't because, I'll explain to you why, but it's not the case. But fluoride is has anti-thyroid actions. So when I wrote my book, I stumbled upon this deal about fluoride and its adverse effect on thyroid. So I looked it up and started doing research on it. And as it turns out, back in the 1930s, the Germans made in fact, it was Bayer aspirin, that's a German company, Bayer Pharmaceutical, and another pharmaceutical company made a compounded preparation to treat hyperthyroidism, too much thyroid, and they used a fluorinated carbon molecule, and I can't remember what the name of it was, and they gave it to the patients to slow down their thyroid. It was an anti-thyroid preparation. Well, it just whacked out their thyroids and burned it up, so they couldn't use that anymore. They didn't. So, but they did use it. They were so wicked back then. They took it and they gave it to the Jewish people in the concentration camp, so that whacked their thyroid, so they couldn't, fight against them. That's what it was used for. Anyway, so I look up has anybody ever heard of the government's Material Safety Data Sheet, MSDS? For every chemical that exists, there's an MSDS sheet, Material Safety Data Sheet. You can go online and look it up. So I said, I'll just look up fluoride. Oh my gosh, it's a toxin. Surprise, surprise. It causes cancer and a host of health problems. So where do we get fluoride? Well, we got it in our water. Oh, we got it in our toothpaste. As a matter of fact, then I'll read further and go home. Write this down when you go home. Get your toothpaste out with fluoride in it and look on the back. The warning on the back. I couldn't believe this. I didn't know this a year ago. I couldn't believe it. So I go pull out the toothpaste because I read it online, and it says, warning, if you swallow any more of the toothpaste that's on your toothbrush, go immediately to the emergency room or call the Poison Control Center. What? Why would I do that? Because of the fluoride. Now, that's crazy, isn't it? We're putting that in our bodies. Well, of course, I don't use that. We haven't for years. I've known fluoride and chlorine and bromide and all this have adverse effect on thyroid. Thyroid has to have iodine. If you remember high school chemistry, the elementary chart of all the elements, there are 135 or so. There's the halogens, and that's bromine and chlorine and iodine and fluorine, and these, well, they compete against one another. So we have chloride in the water, and we got fluoride in the water, and then we got bromine in our soaps and all this. So we're getting all these halogens that are competing against the iodine, and that displaces iodine, so we don't make our thyroid hormones naturally. So that's another reason. It could be fluoride. I'm not saying it's the cause of it, but there's a correlation. It exists. So what can you do? Well, pretty much we've been drinking fluorine all our life, and look at us, here we are. So what you do, here's how we treat thyroid. If a person has the clinical symptoms of hypothyroidism, this is what we do. We give you a clinical trial of thyroid. See how you do. And then we increase it until we get resolution, or if you have symptoms, back off on it. That's how we treat it. We also use it in conjunction with natural bioidentical hormones, sex hormones, and adrenal hormones for adrenal fatigue. Any other questions? Yes, ma'am.
So, does all PCOS people have the hypothyroidism?
Well, let me just say this. I don't know. But I know this, if you've got the clinical symptoms of hypothyroidism, whether you have PCOS or not, you ought to be treated. And guess what we find in treating people for hypothyroid? It clears up a host of problems because it restores their metabolism and the body starts working right. So all these symptoms that seem unrelated, well, how's a headache related to constipation or irritable bowel syndrome? How is a brain fog related to joint and muscle pain? How is my hair falling out related to recurrent infections? What is the relation? Low thyroid. If your thyroid's not working right, your whole body is running slow and sluggish. Step on the gas. Now, this is what you do. You go to your doctor. You have low thyroid, but you got fatigue. So what we're going to do is we're going to give you some amphetamines to speed your body up. Well, that doesn't make sense. Okay, any other questions? Yes. Yes, sir. Hold on.
Is autoimmune thyroiditis the same thing as Hashimoto's thyroiditis?
Is autoimmune thyroiditis the same as Hashimoto's thyroiditis? Hashimoto's thyroiditis is a form of autoimmune thyroiditis. Hashimoto's thyroiditis was named after Dr. Hashimoto. And Dr. Hashimoto discovered back in 1912, when he was from Japan, living in Germany, he discovered antibodies to the thyroid gland. Okay? And so he called it Hashimoto's thyroiditis. Inflammation of the thyroid, which is antibodies to the thyroid gland. Now, you can have, and when it's Hashimoto's, that means you get low thyroid function. If you have Graves' disease, that's where you make autoimmune thyroiditis, and it inflames the thyroid, and you leak out too much thyroid, and you get hyperthyroid. Yes?
So when your doctor takes your blood test and he tells you it's normal, is there like a test that you do that checks for hypo?
Yeah, is there a test that you check for autoimmune thyroiditis? Yes. And there's a blood test you can do for that. That's easy to do. But even in the face of that, I mentioned to you, maybe I didn't, I mentioned in the groups, I've taken the blood work of 40 patients, sent it to the same blood work to 2 different labs, and got 50% different results. So who am I going to believe, lab A, lab B, or the patient? I just don't believe the blood works when it comes to thyroid or any of the hormones, because they say wherever 95% of the people fall is normal. Well, your optimal level may be up here, and you're down here at the bottom, like this young lady. Somebody told her, one of y'all said, well, the doctor told me my blood level was low, but in the normal range, low. Well, that's kind of like a lifeguard sitting on the side of the pool, and somebody comes up, I'm drowning. And they go back down. Come back up, I'm drowning. We're not drowned yet. I'm drowning. They go down. Okay, they're down. Now we go pull them out of the water. Now we're going to revive them. They drowned. Well, so here you are with low thyroid level. You go like, I'm drowning. Can't you just give me a little thyroid? Not yet. It's in the normal range. We'll wait till you go really down. Then we'll treat you. That makes sense. Yes, anybody else? Okay, now I have books over here. If you'll fill, now there's a card. Look in your packet. I have a packet here somewhere. Is there a packet? Was there a packet? Did everybody get one of those packets? If you will fill out a card, I will give you a copy of the book, complimentary. And I want you. And if you don't think you have a problem, I guarantee you have a friend or associate or family member that does. Give it to them, and you may save and change their lives. Yes. Here's the card. Another question.
Yes. Why is thin hair on your outer eyebrow associated with hypothyroidism?
Question, why is it associated with it? It just is. It just is. So is an enlarged tongue. So people with hypothyroidism oftentimes have an enlarged tongue. You know it's enlarged because it's scalloped. You've got a teeth mark. It's growing into the teeth. So go home and look in the mirror. You stick your tongue out, and it's especially long-standing hypothyroidism. You'll just see that. You'll see the scalloping in the teeth, the loss of the lateral third of the eyebrows, the puffiness, the hair loss in women. Mine's kind of male pattern baldness. My dad had it. I've got plenty of thyroid. Now, I'll just tell you this. I started taking thyroid myself, and I take 4 grains a day. And I've been doing that since 1991. I'm 63, but I take all our hormones and all our vitamins, and I eat pretty good. Lots of vegetables. Now, I feel like $1 million. I may keel over dead tomorrow, but I will not have lingered. Yes, ma'am. Cannot buy it over the counter. It's a prescription. The question is non-synthetic thyroid, which would be like Armour Thyroid or Nature Thyroid or a compounding pharmacy, can make the preparation for you. We do at the Hotze Pharmacy. We make slow-release thyroid, so you have a slow release during the day. And here's the problem you're going to have. You're going to go to your physician, your physician who takes insurance. And you're going to tell your physician, I went to this deal, and, wouldn't you just try me on some thyroid? Well, they won't. If they do, they'll put you on synthetic thyroid, if they even do that, and they'll put you on a low dose. And they won't know how to dose you because they've never done it before. They never treated anybody clinically, and they don't feel good about it. They're worried what could happen. They don't know. They're just not experienced in it. So you don't want to put your hands in. You don't want to let people do trial and error on you who have never had the clinical experience of dealing with thousands and thousands of women and men and help them get on a path of health and wellness. And then what happens is you try it, and they put you on a dose, and you don't feel any better, and you go like, it didn't work. Well, it's dose-related. I was talking to one of the ladies. She says she's taking a half a grain. Well, that may be all she needs, but that may be a pittance. She may need 2 grains or 3 grains. And if you don't gradually increase that until you get resolution of the symptoms, you'll never know if your doctor's not willing to do that clinically. So we follow blood work just to make sure you stay within the wide range of normal. But we don't base our treatment on the blood work alone. Does that make sense? Yes, ma'am.
I know you don't base treatment on blood work alone, but for example, when I have a physical, they test the T2, but not the 3 and 4. So is that unusual?
I've never known anybody to test T2. Are you sure that's what they test? Maybe it was the FT index, the free T index or something, but not the. Yeah, it wouldn't be normally the T2. They wouldn't test that. I don't even know you can get that because it's really not even it's a precursor of T3 and T4. Remember, there are two active thyroid hormones. T4, it has 4 iodine molecules. So say my hand is the thyroid molecule, and the fingers are 4 iodine atoms. That's what synthroid, levothyroid, levoxyl, the synthetic thyroids are. That's an inactive thyroid hormone. It's a prohormone. That hormone has to be converted to T3 within the cells or in the gut. Your body makes some T3, about 80% or 90% T4, 10% T3, maybe less, maybe it's 95 or 5%. But T3 is the active thyroid hormone. When the T4 gets into the cells cleave off one of the iodine molecules, and you have the active hormone T3 in your cells. But T4, if you don't properly convert it and you don't get it into your cells, then you can have good blood levels of thyroid, but you don't have it in your cells. It's not getting converted. You have a problem with, we call it, like you've heard of insulin resistance. It would be like thyroid resistance. You're resistant to the thyroid hormone. Well, ladies, it has been a pleasure having the opportunity to meet with you. I have copies of the book. I've done some signing. I'll personalize it with your name if you want it after the program. And I wish you the best. And this is what my prayer for you is, that God would give you all great health and great happiness and great success in your life. Okay, you're welcome.